for me. I'm not going to let you fall. I can feel that you're hesitant.
Ah!
Good job. Ryle's one of my more expressive patients. I forgot about that. She's a little louder. Bottom leg straight. I like your burps. Wish I could work in them, but I can't bring myself to work in burps quite yet. I feel like if I do that, there's no coming back. I'd be the barefoot gyro. All the way out. Good. Sink and relax. If my hand's your pillow at home. There we go.
Got it.
You got that?
Yeah.
And we got it. Hey everyone, thanks for clicking the video. Today we've got a returning patient on the channel, Ryle. You can click up in the top corner if you'd like to see her old video. She's been taking steps to be more active lately, but with that you're going to get your usual stiffnesses, tensions, and tightness. She did just run a 5K, which is a great personal fitness goal. If you've never run one before, I highly recommend that you train for it because I absolutely believe that you can do it. Again, thanks so much for clicking on the video. Don't forget to hit that subscribe button. It really does help me out quite a bit in support, and have yourself a great rest of your day. Ryle, good to see you again. Thanks for coming in. Okay, so it's been a while since Ryle was last on the channel. Earlier this week she was getting some kind of pretty bad upper back pain, but it's since kind of self-resolved. So unfortunately it takes a little bit while to set these appointments up sometimes. But can you kind of talk to us a little bit about what you're feeling?
So behind my chest, my left chest,
yeah,
I really couldn't move it properly.
You couldn't like bring it forward or like, rotate it at all?
It goes, when I go like this, it really hurts.
Okay,
and every time I took a deep breath, it was really hard for me to
like get a full thing of air in. Okay, now since then that's kind of cleared up, right?
Yes.
Okay.
Yeah.
You saw your MD. Did they kind of tell you what they thought was going on with it, or not particularly?
No, nothing particular.
Okay, that's okay. I'm glad that it cleared up for you. Okay, based on it being that quick, it sounds like it's a bit of a rib complaint. If you're having trouble getting a full thing of breath in, absolutely, rib complaints are on the top differentials there. But I'm guessing it was quite painful then too. It was also on the left side.
Yes, so literally behind my left chest.
That can be a little concerning because that's also the area that some people will think that they're having a heart attack in. Okay, rib complaints are oftentimes mistaken for them. Made a whole video about that. Regardless, you're feeling better now. That's the good news. Just want to touch base on that. You okay if we kind of do the usual stuff then for today? Neck, upper back, lower back? Awesome. We'll get you right into it then. Okay. How do we feel up in right there?
It's painful.
That's painful there, right? Okay.
Yeah.
So can you see that closely on the camera there? That's her left scap, okay? It's that muscle that connects into the top of her shoulder blade. This is her shoulder blade here, okay? Left scap connects to the top, comes up into the neck, but right there, big area of tension for her. Take a breath in, all the way out. That was a really big one. You okay there? It's okay. That was a big one, but there was a lot right there, so I'm happy we were able to get it.
So what's going on with my back?
You tell me. What have you been up to lately? I noticed that on your stories you have like a lot of training stuff going on. Did you run like a half marathon or a 5K or something?
It was a 5K.
It's a 5K. Yeah. Okay, good. Yeah, you're being healthier, and I think that's a good thing. I think you're making that a priority. But with that increased activity, you can kind of get stuff like this. A little bit on this side too, eh? Not as bad as the left though?
Yeah.
Okay, breath in, all the way out. There you go, there it was.
So why is my back so stiff?
Yeah, probably. You seen a massage therapist or a physio or me? I know you haven't seen me
Just
lately.
you.
Just me? Yeah, okay, so that could potentially be why. Like, again, if you're increasing your activity, that's good. Okay, that's going to build your resiliency, but sometimes you kind of need a bit of a reset when you're doing that. Okay, so seeing a massage therapist or a physio in between me could be beneficial, or you could just come hang out more often. Your call. Yeah. Hold right there. Comfy? Or comfy-ish? All right. Big breath in, all the way out. Relax for me. I'm not going to let you fall. I can feel that you're hesitant. Good job. Ryle's one of my more expressive patients. I forgot about that. She's a little louder. Push your right there. Good. Bottom leg straight. I like your burps. Top leg up. I wish I could work in them, but I can't bring myself to work in burps quite yet. I feel like if I do that, there's no coming back. I'd be the barefoot gyro. Yeah. All right. Big breath in. All the way out. Sink, sink, sink. Relax. There's a little one there. One more. Breath in. All the way out. There we go. That was a big one. Good job, Ryle.
Does it matter which way I sleep?
Yeah, absolutely. So, I mean, the way that you sleep, do you shish kebab? Do you like turn all the time, or do you stay in one spot and that's how you just pass out? You shish kebab, eh?
Yeah.
I shish kebab too. Drop, drop, drop. I'd say that's actually probably the best way to sleep because you're constantly changing up the passive forces on your body that gravity's acting on when you're sleeping. Movement is always a good thing. Okay, it's usually the people who get like that dead sleep, don't move, wake up with a lot more stiffness than those who are shuffling around. But do you feel like you're waking up in a lot of discomfort or pain or no?
No.
Good. Then keep shish kebabbing.
Okay.
Yeah. Doesn't matter if it bothers Leo or not. If you're like disturbing him at night, just get your sleep. Leo, I'm sorry. Okay.
How's my neck?
Kind of like your upper back and your lower back. Stiffer than I remember, but it's also been a while. How do you feel as I poke in through the left side? At least I haven't done the right side yet. Yeah, you can feel that? Okay. Let's see the right side before we get into adjusting. Just drop into my hand there. Good. It's a gorgeous day out today. Okay. It's like 23 degrees Celsius, not Fahrenheit. Yeah. All right, so I'll get you to just, you can see from that position there? Drop into the head, drop into the hand, excuse me, just relax. Ooh, okay. You know what, we're gonna come back to that one after we do the left side instead, okay? Drop into the head, good. I will wait all day with you. That's fine. I'm in no rush. I can tell you're nervous, though. Why are you nervous? We've done this before.
I don't know.
Breathe for me, okay? Just take a second. It's okay. We'll do a reset. I'm not even going to touch your neck yet, okay? So this is a good passive stretch for the traps. Okay, if the patient is a little bit uncomfortable, you can just do some more muscle work before you kind of get into the joints there, okay? Do you feel that kind of up into the back of your skull almost? Yeah? Okay, good. We'll turn you around here. Same deal here. Okay. Drop. Same deal. Okay, just let me hold your head. Good. There we go. Coming back to you now.
Mm-hmm. Okay.
Okay, one more go. Drop, relax there. See this muscle here? We need this muscle to turn off, and you do that by just letting your head sink with gravity into my hand. So sink.
Like this?
Don't push. Sink and relax. If my hand's your pillow at home. There we go.
Got it.
You got that?
Yeah.
And we got it. Well done. All right. How do we feel up in these traps here?
It's very stiff.
Very stiff. Huh? Okay. I'll get you to look up and to the left for me. Okay.
Oh, left.
Yep. Up and to the left. Good. Crushed it. Now slowly down and to the right. Go ahead. Up to left. Slowly down to right. Up to left. Slowly down to right. And left to left. Right to right. Any fun summer travel plans coming up, Ryle?
I have 7 weddings to go to.
You're like me last year.
Oh yeah.
Holy crap! 7 weddings.
Yeah, because my high school friends are getting married.
It's that age group, right?
Mm-hmm.
You're younger than me, right? I think you're 95.
98.
You're 98. Okay, you're several years. Never mind. Wow, I am older than I realized. Okay, I just felt really tired saying that sentence. Yeah, no, but you're that age group now where like everybody just decides to get married at the same time. Legit 7 weddings for me last summer. Now I'm happy that it's you and not me, respectfully. But good luck. Account for it in the bank account.
Yeah.
Are any of them destination weddings?
No.
Okay.
No.
You nodded for a second. I was like,
No.
oh, you poor thing. Okay. I'll get you to look up and to the right, okay? Good. Slowly down to the left. Go ahead. Up to right. Slowly down to left.
Any weddings on your end?
Right. No, not yet.
Okay.
And Nicole and I both hope it stays that way because we're super weddinged out.
Mm-hmm.
We got a couple for the next summer, but that's a ways away. Yeah. And who knows, she might get tired of me by then. So, yeah.
I don't think so.
I know I'm irresistible. She can't get rid of me. Yeah. All right. Up to right. Down to left. That was actually really nice of you to say, by the way. I appreciate
course,
that.
yeah.
Genuinely. I get you the face forward. Tilt the right ear to the right shoulder, please. Left ear to left shoulder. Right to
How
right.
is she doing?
She's doing well. She's a chiropractor as well. Those
Mm-hmm.
people who don't know online watching, but yeah, she's a chiropractor. And she's doing well. She's loving her job. It's a really fun job being a chiro. Can't complain. Yeah, left to left.
And she cracks your back too.
Right. No, because we're not allowed to actually do that. That's the unfortunate thing. In Ontario, you're not supposed to do that. So we have our respected chiropractors. I'd like to go to the student clinic that's nearby here, and she just sees somebody at work.
Oh, okay.
Right to right.
Because that would have been cool.
Well, if we do get married, then we can. But until that point, until she asks me, it's because I'm not asking. I'm a progressive man. Left to left. Yeah, right to right. Left to left. Right to right. Left to left. Good. Awesome job. Okay.
Traps is what, the upper?
So Ryle's traps are the things that are really kind of bothering her when I go ahead and poke something. The traps are the big triangular muscle that start all the way up here, come on down, connecting to the shoulder, and then come down, snake into the spine. Okay. But the upper traps are predominantly the largest culprits. The upper traps are everything right here. Okay. So are you okay if I can just pull that to the shoulder?
Yeah,
there? Awesome. And then I love the little necklace there. That's cute. I'm just going to try to slide it out of the way though. Okay. There we go. And we're just going to scrape on that. You remember the redness that you can get with this? Okay, good. Totally normal. Should clear up within 72 hours.
The first time you did this to me, I was like, whoa, hickeys.
Yeah, so that's why I have to warn people, because it actually does kind of look like a hickey. So if you have like a job interview coming up, or you work with other people, it can look a little alarming. And then I also have to say it so that when you go home to your spouse or your parents or whoever you live with, right? They kind of you can give them the preamble, right? Mm-hmm. You can tell them, no, it's normal. I saw my chiropractor, but then clarify it's because I did this to you and not because you saw a chiropractor, because that can make things worse actually. But all the same, yeah. So again, we're already getting some of that redness right here. Okay.
Okay. I saw my YouTube video.
Yeah.
That
I did. The old one, the first one?
Yeah, the first one. And I saw like the whole progress when it came all red. I was like, whoa. That's me.
It must be kind of weird, because I do follow up with like most of my patients I make videos with. But it must be weird like watching yourself if you're not used to it. And me, it's just another day. But like for you, like how often do you see a recording of yourself?
Not often.
Yeah, probably not very often, right? So you did great, and I'm happy you're willing to help out once again.
Of course.
So. Yeah, so we can already see quite a bit of redness showing up in those traps there. As a reminder, that's an indicator of fascial adhesions that's happening there, connective tissue. That's okay. If we keep working on it, if we're consistent with it, it'll clear up. And it's also really not that big of a deal to begin with. So, okay, so I can also kind of work up into the neck here.
Wow, I really feel it.
Feel it up there, huh?
Yeah. Often.
I'm not going anywhere. I'm right here, willing to help anytime, right? Now, again, I was actually telling Ryle this off camera because she was worrying about why she keeps feeling the stiffnesses every time she comes in. Like, it's not interfering with your day-to-day, right? It's not interfering with your exercise, your ability to be a partner, or your work, right?
No.
It's not hurting either. So if it's neither of those things, it's kind of like you don't even really have them, right? Now, when you do come in, obviously it's my career to find these things and release them, free them up, because they can cause issue if they go unnoticed for long enough. That's when you can start to develop chronic levels of stiffness and whatnot. But it's also not the end of the world if you leave it, okay, because we can recover with that. I do advise you see someone, obviously, just get checked in every now and then. But if you can't, if you're super busy, or if the budget is very tight, don't sweat it, okay? It is not the end of the world. You do not need to, you don't need to give up something else to be here, okay? You'll be fine. So rib complaints in my experience largely stem from a lack of upper back or thoracic mobility. Okay, the ribs, they connect into our thoracic spine, which is our middle spine. So if we can get more mobility in there, they don't spasm up as much.
Yeah.
So the way I like to do that is I like to find a seat or something that I can sit on and kind of like straddle with my legs here. Okay. So once you're in this position, you're going to kind of turn and rotate pretty much as far as you can. Okay. Once you're in this position, you're going to just kind of relax, but you're going to take a big breath in, and you're going to try to get it as much into your belly as possible. Okay, you're really going to try to expand that belly, because that expands the rib cage, and when you expand the rib cage, that mobilizes everything in the back. Okay, so you're going to turn as far as you can, 10 deep belly breaths. You're going to do that 10 times. Okay, nice and slow though. Okay, I'm speeding it up for the purposes of demonstration. Once you've done that, what you'll find is that you'll suddenly be able to rotate a little bit further. Okay, and then you're going to do that again. You're going to be able to rotate a little bit further. You can do that again, and then that's going to be your max, okay? You're going to complete that on both sides. I do this exercise pretty much every day because I get these rib complaints, that it really helps me keep them at bay. Breathing helps to target the rib issues specifically, okay? Whereas the stretching is just the upper back muscles. Do you want to try that here?
Sure.
Okay. And keep doing that. Rotate further, big breaths in, rotate further, big breaths in, and the same on the other side, okay? You can do that once or twice a day, 3 times on both sides. Going to decrease the likelihood of you getting those rib spasms, okay? And of course, if they do actually happen and come back, just call me. I'll see you same day, okay? And that'll usually free it right up. Chiro adjusting specifically is very good at dealing with rib complaints. Okay, there you go.
I think it was also because I just got into golf. So when
Yeah, so golf is a really common rib aggravator because, especially if you're not warmed up, it's that twisting motion of the upper back, up and goes, 100% a rib. Okay, very, very common golf injury. Yeah, so if you're a golfer, save that exercise. Don't forget to hit subscribe either. Any other questions?
No.
No? Awesome. Well,
Yeah.
Ryle, it's always great to see you. Thanks for coming
Awesome.
on in.
Thank
Appreciate
you,
your help
Adam.
today. Take care.